Welcome to the Works of Wonder podcast. This podcast was inspired by the powerful message of Beyond Words, the art of effectively communicating with your children, written by Dr. Beth Long. Beth is a licensed professional counselor, a board-certified behavior analyst, and the founder of Works of Wonder Therapy here in Montgomery, Alabama. Each week, we'll talk through real stories, practical tools, and faith-rooted insights that help parents lead with grace rather than fear. We hope you enjoy it. Welcome back to another episode. Today's topic is really fun, but before then, we have Phoebe Buffet.
We do. Still Phoebe Buffet.
Ready for her sticky shoes. I think you should give us a little bit sticky. Get it?
I don't know stinky shoes. I only know smelly cat.
Oh.
Smelly cat.
She's like, why you stick on me? It's so good. It's so good. Okay, well, she's still a little bit under the weather, but she's doing great. The color makes you look so healthy and vibrant.
Oh, great.
And today we're going to talk about potty training.
All right.
Topic.
This is honestly one of my favorite topics because I did all my ABA CEUs in it one year because I got that many questions on it. And I was like, nope, I'm going to learn all the ins and outs of it. So I love it.
That's great. I have 2 more to potty train.
Ooh.
Right? Yes, 2 more to potty train. So I'm ready for the tips and tricks because I feel like even though we've done it 3 times, we still don't know what we're doing. Don't know what we're doing. So potty training is one of the most emotional milestones for parents.
Yes.
Arguably. It brings pressure and comparison and fear and frustration. They'll never be able to go to a birthday party. Just all the things.
Or sleepaway camp or whatever it is.
Anything. Yes. Why does potty training feel so overwhelming for parents?
Because it is.
It is.
I mean, I think that's the honest truth, right? It just is. It's messy. It's annoying. There's so much progress and regression. It's just overwhelming.
Mm-hmm. It is. And it's something that takes you so far out of the right now because you do. Like, it is one of those things that puts you in, they're going to have a diaper on at graduation. And all the things.
Yes.
You teach that behavior is rooted in skill. All behavior is rooted in skill, not defiance. So how does that lens change how we view potty training?
I mean, I have heard people say they know better.
What?
About potty training. Right. I mean, I have heard people say that. And, right, potty training truly, truly is. We could debate some things that I think are skills and other people don't. We could debate. True. But potty training, it's black and white. It's a skill.
Mm-hmm. Mm-hmm.
It is a skill.
It is. And it's something that is one that you can, it's like a use it or lose it skill when they're in those really young years.
Yes, it really is. And some days they have more capacity for it than other days.
It's true.
It is what it is.
What are the most common signs that a child is not yet ready?
Okay. If they are not uncomfortable by being wet or dirty, do not even waste your time. Because that is the internal motivation to be bladder and bowel trained is discomfort. So not all children necessarily feel how gross it is. And if they don't feel it yet, let it go.
Okay. What if they just turn 3, 3.5, we're panicking and they're still not feeling that?
I would definitely, we have met some children who had to go to physical therapy because there were muscles and there were, I guess it was nerve endings. I don't know. That may be the stupidest thing I've ever said, but they literally didn't have that sensation of I'm wet and gross. So they had to do some therapy. So I think if you get that old, I would just talk to someone about that just to make sure there's nothing more complicated going on.
Okay. Why does pressuring potty training often backfire?
Because they have control.
They do.
Right? When little children, we have a lot of control, but their bodily functions are 100% in their control.
That's like one of the first things that you see that you do not have control over.
Yes.
It's a nice little gateway into the rest of their life that you don't have control over. But that potty training is like the thing that they can just be like, no, you will not make me poop on this potty.
Yes, exactly.
Yeah. And that can lead to resistance, accidents.
Yes, because there is a lot of fear that comes into it,
Absolutely.
right? Especially bowel training because they can get constipated and then it is painful and then they avoid the pain, right? It's just, it's such a complicated issue.
How can parents reframe accidents as important information instead of a failure?
So I think I always the natural consequence of that is, right, you get to help me pick it up, clean up the mess. But also it's just a learning experience. And if you make them part of that cleaning it up, they're not going to like that either. And so it's going to expedite their learning a little bit. But it is just, if you were teaching them how to drive, hopefully they won't have accidents, because you don't teach them how to drive a place they can have accidents, right? But it is just, it's part of the learning process.
Okay. What foundational skills need to be in place before potty training can be successful?
Okay. Pulling up your pants, pulling down your pants.
Okay.
Right? Because if you have potty trained a child, you'll know what I'm saying. But that urge to go to the bathroom comes on like that. And if they don't know how to hop on, like pull down their pants and hop on the toilet, you're going to have an accident. And they can be, trying to do everything right. So starting long before you start potty training, make sure they know how to do that. Working on snaps, working on, like truly just making sure your child knows how to handle that in a difficult situation.
Okay.
Where they're about to wet themselves.
And I'm sure this is just a whole different game with neurodivergent kiddos.
Yes.
But what if you're working with a slower to speak, or you're potty training really young where they don't really have verbal communication? Is it possible?
It is very possible.
Okay.
It is. The number of repetitions is going to be significantly different. And if they have a language delay, it all has to be visual.
Okay.
So one approach that we use it's by Fox and Azrin. It's an older approach, but it's beautiful. But it's buying one of those, I can't remember what they're called, but it's the little baby dolls that you feed the bottle and they go potty. You know what I'm talking about?
I don't know the name of them.
Baby Alive, maybe?
Maybe.
Okay.
Yeah. That sounds good.
So it's a lot of showing that, because if you have a language delay, it has to be something that you see and you experience. So it's using that to help them understand, like, oh, we go on the potty and the liquid goes in the potty. Or taking them with you and like helping them see, like, no, this is what happens. And then putting them on the potty. This is way before potty training, but putting them on the potty and helping them understand, like maybe accidentally they go, or just helping them understand the process of sitting on the potty. But it has to be right. If they have a language delay, you're not going to talk them through the process.
Right. No.
You have to physically do the process and visually do the process.
Okay. That's really interesting. I never thought about that. What does practice time versus game time look like in the context of potty training?
Okay. When we start potty training, number one, can I jump right into the steps of potty training?
Yes.
Okay. Number one, put your child in underwear.
Okay.
Because pull-ups wick away the moisture, and they have to feel wet to be motivated not to wet their pants, right?
Yes.
So you can put a pull-up over their underwear to protect your house. However, they have to feel wet. So put underwear next to their skin. So that's number one.
Don't let them be. Let me just tell you, I have enough kids so I can say one of mine, and like we don't know which one. We tried the just stark naked. Ooh. Okay. Sorry. They went on the ground and then was like, and slipped and like cracked their head on the coffee table. So we were like, no, potty training's done for the day. We're done. So yes, to underwear, not stark naked. Don't do it.
Okay, that's pretty awful.
It's awful.
Especially when you have as many kids as you do. Anybody could be sliding.
There's pee everywhere. Pee everywhere.
Okay, so yes, so that's number one. And then number two is very, 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 very intentional time practicing using the bathroom. Okay. So you don't have to do it all day long every day in the beginning, because we're going through the motions and just learning the whole process. So I would say maybe on the first day, even an hour, and then the next day, a couple of hours, and the next day, 3 hours. But you're going to take your child to the bathroom every 10 minutes. That's a lot, right? Which is why I'm saying don't dedicate the whole day to it. You can take this approach and rip it off like a Band-Aid and do it in 2 or 3 days, but very few people can commit 2 or 3 days to solely taking their child to the bathroom every 10 minutes.
Yes.
So So then the rest of the day, you put the pull-up back on and you
Okay.
move on with life.
Okay. Yeah, that's like a tell me you have one kid without telling me you have one
Yeah.
kid. As if you can commit just the whole day to that. That's good, though. That's good. And have you seen a lot of success with that method?
What I'm trying to think. Just I don't want to lie. Bladder training. Every child I have ever worked with using that method has been able to be bladder trained.
Wow.
Bowel training is a little trickier
Okay, speak on it.
and more. There's a lot more.
Let's talk
components.
doo-doo.
Whew. Okay. So this is where I'm sorry, it just caught up to me what you just said. Okay. That's my own ADHD. Okay. So, I personally tell parents to look at them as 3 separate skills. There's urination training, there's bowel training, and there's nighttime training.
The worst one.
It's the worst one, and I'm all about some good nights. Let that go for a little while because I'll choose sleep over everything. But let's talk about bowel training. So bowel training typically happens by accident because you can't. Right, urination training is so frequent. You can practice it. It's repetition. You know they're gonna, go to the bathroom. Bowel training, the minute we change how they have a bowel movement, they're going to become constipated. Right? It just is what it is. So you have to almost embrace that and accept it. Step 1 is if you see that they're passing gas a lot, if you hear them grunting, most children, not all children, but most children go and hide. So when they start doing all those little things that we know they're doing, then grab them, put them on the toilet, try to keep them in the same position that they do it naturally. So if they're squatters, try to stand on the potty and squat.
Okay.
I have met a couple of kids who just stand. So it all depends
We don't
on how
even know
you feel,
logistics, but
right? I know. I'm honestly, but most kids kind of squat or bend forward, or So try to keep it as natural as possible. And then after that happens, especially if they're neurotypical, 2 or 3 times they get, I don't have to be laid down and cleaned up. Right?
Cold
all
wipes.
of that stuff. Yeah. So they bypass all of that and they're like, oh, this is so much better. This is so much better. So that's kind of how bowel training happens. There's a couple of components to it. One is wiping is a whole nother skill in and of itself, right? And so I saw this thing where somebody was putting like an apple, some peanut butter on an apple and teaching the kid to wipe it off. I'm like, oh, you know what? That's actually
The
pretty smart.
balloons. I've seen Nutella on like, 2
Yes,
balloons.
yes.
It's a good one.
Yes, it is. It is. And then like helping them just practice rotating their trunk so they can actually wipe. Just little bitty things like that, because that's a whole nother skill.
Yeah.
But I mean, I feel like when they're very first learning to have a bowel movement, they are not necessarily old enough to wipe themselves clean anyway.
Don't trust that.
Yeah. Yes. But there's a huge difference between having to lay down and having to stand there. And anyway, huge difference. So kids naturally do it.
We talk about it with food, but like having a bowel movement is different every time. Like it's just like sometimes it's scary.
Yes.
honestly.
Yes.
And,
sometimes you strain, sometimes you don't. Yeah.
Sometimes it hurts, sometimes it don't.
Yeah.
So it makes sense that they're a little bit nervous about it.
Yes, very much so. And if somebody changed how I did it, I would freak out a little bit too.
For sure.
But here's some helpful little tips. Juice helps move the bowels. I should probably have asked a pediatrician, ask your pediatrician, but for adults, they recommend grinding up flax seeds and chia seeds and sprinkling on food like pepper. That's a lot of fiber.
It is.
Very easy, very natural. And then when they're on the potty, like I have seen a lot of parents teach like strain. That's not actually how we move the bowels, but help your child take in a deep breath.
Yeah.
And the air moves the bowels, and then just rocking back and forth side to side. So
good.
there's all kinds of little tips and tricks, but also just have a lot of patience because if somebody came in and changed how you did that, right? Like I get constipated every time I go on vacation, you know, and that's just the change of scenery.
I eat a lot of flax seeds. Not gonna lie.
Wow. Okay. No. My body is like, this is not a familiar environment. We're shutting down. So if somebody changed how I, you know, if they removed my bathroom and I had to start going in a diaper, I'd probably shut down for a week, you know? So anyway, so I have a lot of grace for the fact that it's just difficult.
Yeah. Going back to a little bit of the neurodivergent potty training. Why is body awareness delayed in neurodivergent children?
So in a lot of neurodivergent children, their central nervous system is not developed 100%. So that's why they overreact to certain stimuli, to noises, to lights, to sound, right? All of that. So it comes into play in potty training because they actually do not feel that internal urgency to go to the bathroom. And so there's a lot more teaching that has to happen of just recognizing in their own body what that sensation is.
Yeah.
And then you can't talk about it.
Yes.
So it's even more complicated. So that is why we have to take them so much, because there's so many dots they have to connect.
Okay. You talked about the visual learning. Are there any other simple adaptations that parents can implement?
I've seen a lot of, okay. I'm going to say this, but I'm going to try to explain it well, because I think there's so many helpful tips that people throw out there on social media or in other, you know, formats. But they don't give the whole story. So I'm going to try to give the whole story. Okay. So if we use what's called a picture schedule or a picture exchange communication system, and we put a potty on that, we have to teach them how to use that system way before we're potty training. Okay. So I like to tell parents to put maybe their sippy cup and a picture of their sippy cup and a blank card on the refrigerator. And then every time they let me know they want a sippy cup, I take them to the refrigerator and I touch it. And then I say cup. Anyway, and then they get the sippy cup. But if the child just walks over and touches the blank card all the time, that's a good sign that they have no idea. Right?
Okay.
But if they walk over and they touch the sippy cup all the time, then I know, okay, they understand if I point to the picture of the sippy cup, I get a sippy cup. That's when we add another picture. And then if they use 2 pictures correctly, that's when we add another picture. So then we have 3. So if you're going to use a system like that, you're going to have to make sure that they know that. And if you don't want to take the time and energy to do that, slapping up a picture of a toilet, it's not going to help anybody, right?
Yeah.
So they need to go out of the way to teach that system, and then you can like put something so it says that. Most of the time, though, most neurodivergent children will hand lead, and so once they're beginning to understand the bathroom, they'll drag their parent to the bathroom, or they'll run to the bathroom by themselves.
Interesting. Okay, talk just briefly, because this is like a big topic, on night training.
Oh,
Because I tell you, that's an area we struggle with.
I am a big believer in, once again, I'm going to save sleep, right? So,
Yes.
But you have to restrain liquids. I did, when my children were probably about your children's age, right before I went to bed, I would go and like in their dreamy state, take them to the bathroom. And then also incorporate them in cleaning up the sheets so that they're motivated to not. And when we come in and we just rescue them,
Yes.
right? They don't have to suffer anything. So it's just, that's a long time, especially if you have great sleepers who sleep like 10 hours. It's a long time. So there's a lot of things you can do, but most of the time, not all, but I'm going to say 99% of the time, their bladders have to grow large enough to hold liquid for that amount of time. And so just kind of wait it out. Nobody is like, oh yay, I love to be wet in my bed. Nobody does that.
Yeah.
So as soon as they're able to do it, they'll do it.
And there's like a bunch of, you talk about like going to the doctor because there's a link with mouth breathing and bedwetting. There's a link with ferritin levels and bedwetting. There's a ton at play there too.
There really is. There is. So yeah, I mean, it's
prolonged.
Definitely,
yes,
it's definitely something worth talking to your pediatrician about. And there are a few children who need more help. Especially children who do have sleep apnea. Like you said, there are little bitty things in there that can matter. So always ask your pediatrician.
Yeah. What's something you could leave us with to encourage parents who feel ashamed or behind or all kinds of things about potty training?
Don't compare. Never, ever, ever compare, right? Comparison is the thief of all joy. So I personally potty trained my son outside because we were outside a lot that summer. I was doing a lot of landscaping and it was easy. And then he transitioned right to the toilet. So be willing to be a little like what's the best for us in this season. So be willing to do that a little bit, but then also never, ever, ever. It's a skill that they have to be taught. They can learn it. Some children are going to take 2,000 times going to the bathroom, and some children are going to take 100. And just be consistent and don't use pull-ups.
Ooh,
I think that's the biggest mistake that most
be canceled by Pampers.
Yes. But you can still wear them over
Diapers,
your
great.
right? Yeah, you can still wear them over it. But they just have to have that biofeedback to be successful.
Okay. Well, that was super informational. I'm ready to go home and potty train my last two babies. But yeah, don't forget to follow Dr. Long. She has all kinds of tips and tricks on all different things, parenting, caregiving, all mental wellness, just a wide range of topics over on her social media, Facebook, Instagram, TikTok. Works of Wonder is also on all of those platforms. We'll have all that linked below. Pick up your copy of Beyond Words on Amazon. We'll have that there too. Thanks for the encouragement.
Thank you. And always be kind and honest because it works wonders.
It does.